role of a radiology physicist is to provide support to medical imaging departments within hospitals to make sure, really in a nutshell, that patient images are required at the best image quality and the lowest possible radiation dose. And there's a number of tasks that we do to enable that goal to be met.
A medical physicist is a scientific support person for diagnostic imaging, an interface between technology and physicians, an interface between technology, safety and everybody else who enters the hospital environment. On a day-to-day basis, I always check, for example in nuclear medicine, the quality assurance of every camera that we use. So it's daily floods and all that sort of business, to make sure that our cameras are optimised for the best image quality that we can provide for the diagnosis of every patient that comes in to our department. Optimised images means less radiation dose, faster throughput for patients, less waiting times. At least from our technical aspect, if we can get patients through at a timely manner, we can help the whole service improve.
There's no such thing as a typical day because we do a wide variety of tasks, but some of them would include quality control of X-ray equipment, monitoring of staff doses, monitoring or calculation of patient radiation doses. We do radiation shielding calculations to make sure there's lead in the walls and people working in adjacent areas are safe. And we do a lot of teaching to anybody working with radiation within the hospital. And that extends beyond the X-ray department to operating theatres and cardiac cath labs, for example.
The mere process of quality assurance and quality control at a high level is adding value all the time by providing optimal image quality, so that enables our physicians to provide the best diagnosis that they can at the lowest radiation dose to the patients.
It ensures that the service can provide a wide range of clinical tests. The main way to describe this is as risk mitigation. So we're minimising the risk of miscalling a diagnosis because of the assurance we're providing on data quality. We're minimising unplanned equipment outages through our quality assurance programs, and we're ensuring regulatory compliance through the work that we do for radiation safety.
For nuclear medicine, I see the PET-MR systems being the most exciting development in the near future. We've already seen PET and CT work very well together, so PET and MR should be another leap forward in providing high quality images for our physicians.
Some of the exciting things are certainly the new technologies that are coming into the radiology department, particular new CT scanners and new multimodality imaging where they can combine different types of imaging like fluoroscopy and CT.
On the horizon for nuclear medicine, there's new instrumentation like the whole body PET Explorer system. This is massively more sensitive than existing PET cameras and is going to enable us to do tests or do scan protocols that we can't contemplate now, low dose, long time point, that kind of thing.
This is the era of personalised medicine, and we are trying to tailor all of our diagnostics and our treatments to be the most appropriate ones for that particular patient at this particular point in time. So it's important from a safety point of view, but it's also important that we try and maximise the treatment efficacy that we can achieve.